Well, welcome, ladies and gentlemen, to MediBridge Access International. Today, we are conducting a pre-test of our services on our first live stream channel via YouTube in our live stream network. Today is going to be a short discussion just to kind of create a basic awareness and see how our system runs. I have with me the Chief Executive Officer, Mr. Samuel Bazi, and I'm Charles Howard, Executive Director. Anyone in the way it goes, but we are the leaders of the organization of the service. And today we just want to have a tete-a-tete to see how it goes and give you some basic information since you're beginning to tune in and subscribe to our channel. We also ask you to please encourage other Liberians to start to subscribe to our channel because out of this channel, we're going to be bringing a lot of health information for the country, for everybody throughout Liberia, West Africa, and yea, the world. So anybody that is interested, please ask them to come and subscribe to our channel because it is coming, and it is coming big time. And of course, we thank God and we thank Allah for that as well. So welcome, our brother Samuel. Welcome to our live test stream. Good to see you in a nice African shirt. I wish I come to Moravia, I will steal that shirt from you.
So thank you so much, Charlie. It's a pleasure being on this live, especially to talk about our future, MediBridge International, a healthcare delivery entity, especially 80%, digitalized healthcare delivery entity that aim to bridge gaps between physicians, patients, and that of our pharmacists. So to holistically give access to healthcare wherever you are, despite your political connection, your religion, your Greek ethnicity, whatever it is. So I'm glad to be on this live with you, bro.
Thank you, brother. Yes, so uh, you got pregnant. The people can say you got pregnant with a baby, and we came together to try to make this baby come alive and grow in the society. What I'm trying to say for those of you who don't understand in different parts of the world, I would say is that the idea was birthed by him, and then we collided somewhere in the road, and we pick it up and we start to run with it, and now we're doing our best to make it a reality in Liberia. The focus here is that for the first time in Liberia, we want to digitize and provide healthcare delivery services to our people throughout Liberia, irrespective of your background, educational level, location, or whatever it is in our country. And I will explain that. He will explain that too. When we say digitalize, digital service of medication or services to Liberian, we're not going to be a hospital. Let's get out of the way. We are not a hospital. But what we're trying to do, as you see, our name says Meta Bridge. We want to be that bridge between the healthcare delivery services, the hospital, the clinic, the pharmacy, the health centers, and the citizens. For example, you sitting in your house and you don't feel well. You don't know what's happening. Well, you can call our line. We'll have a healthcare professional that will kind of go through a discussion with you and kind of generally pick up what your condition is, and then they can make a recommendation either to go to the clinic or go to the hospital. And if you want, we'll be able to also set up an appointment for you at the hospital we know best or nearest to you. Or if our nurse or doctor on the phone can determine that, listen, this case require a different kind of attention, we will know exactly which hospital to send you to. We just lost our director because he's in Liberia. I'm out in the States. So the network in Liberia kind of are off and on. He will join us again. So I will continue the discussion. So what happening is that you need medication. You can go out to get a medication. One, you can pick up the hotline, go to our mobile app, go to our website, even go to our Facebook and social media outlet and interact with somebody or our customer service people, or we will be there to accept your doctor prescription, your medical prescription from your doctor. We can do two things. We can tell you which pharmacy or you can find out medication in, given the radius of where you are, the area where you are. Sometimes maybe living in Nukutan, Painesville, Gardnersville, Mount Barkley, Kakata, Morovia. But the medication is in the pharmacy in Painesville or in Lucretan across the bridge or in Gardnersville, wherever it is. We know that pharmacy had that medication. We can tell you, oh, or John, go to this pharmacy in Painesville or in Lucretan or in Gardnersville. They would have we'll give you the pharmacy name. We can even give you the pharmacy phone number if need be. Okay, that's one phase of it. But in a case where you can't go, you in Synco, and the medication you need is in Nukutown, and the pharmacy we know that have that thing, and vice versa. You're in Nukutown, and the medication you need is on Broad Street or is in Painesville at Lucky Pharmacy. So you can't get in the car, get on bike, and travel across town to go easily. So what we do is that once you pay the money, we will order your medication for you, and you have two choices again. We can deliver it to you, or we can tell you where to come and pick it up. The best thing would be to deliver it to you. And to deliver it to you, in many cases, we may not be able to come directly to your house, but we are going to have drop points in all of the communities within a 5 minutes walking distance from your house. So we're going to circle the community. We have our guys now mapping out the communities around Morovia and its suburban areas. Okay, so they're going to have the drop points, and we have coordinators for all those drop points. So let's assume you in Synco or in Synco between 9 and 10th Street. So if you're in Synco between 9 and 10th Street, we want to welcome back our director. Like I said, it's a network problem in Liberia, so please bear with us. I'm going to continue talking because he's coming back in. So I'm saying that let's assume you're in Nuku Town and you need a medication, and it is not in Nuku Town, but it's in Lucky Pharmacy on Broad Street or in Synco. Well, what we can do is that we will order that medication for you, and we can deliver it to you in Synco. Just give us your area. We will know that. Let's assume you're on 10th Street, or you're between 1st Street and 10th Street. Once you're between 1st Street and 10th Street, we have several drop points. We tell you, okay, Sarah or Charles, go on 10th Street or send somebody to 10th Street to the gas station or the intersection or to this drop point. You'll meet our delivery person or delivery agent there. When they get there, they will give you a medication. But they will not just give medication to people that come and say, oh, I order for medication. First of all, you got to have a doctor-approved prescription. And then we get the medication, and we have a special code that will change every time. Okay? We give that code to you when we're talking to you. And when the agent bring the medication to the drop point and you come, you have to give that code. And our agent will put that code into our app, and it will pop up with your name and your picture. They're looking at you. If you're going to send somebody to pick up the medication because you're sick, you have to give them your ID card. Okay? If you don't have an ID card, then we have to have a special kind of a descriptive information about the person you're sending. That person have to give an ID card for us, for our agent to give them the medication to bring to you. That's one of the major services we want to provide for Liberians. Anywhere you are, even if you're in the counties, we have a way to do it, because right now as we speak, we have drivers who run transportation daily in and out of the counties, from Morovia to all the different counties. If you're in Grand Bassa, Sino, Maryland, Grand Jida, Nima, Bon, Banga, Bapoli, wherever it is, and you don't have a pharmacy there, or even if you have a pharmacy but you don't have the medication, if you call us or go to our mobile app and submit your request, your prescription request, once it is approved, you pay the money, we'll get the medication, we'll go to our driver, we know going to Bomi, Lofa, Ganta, whatsoever, we'll give it to them. It will tell you, call and say, okay, man, Ginny, your medication is given to this driver, and he's coming in, he'll be there. If it is Lofa, God's willing, he'll be there tomorrow or 2 days from now. Go to the parking station, send someone to the parking to pick up your medication. In Buchanan, they will be on Tottenham Street or wherever it is, and your medication will be there. If possible, we can even send it to a pharmacy near your area in the counties or the town where you have pharmacies. We'll send it to that pharmacy, and then you go there and give your name and your code, special code, ID code, and they will give you your medication. So we're going to try our best to spread it. It's not going to be instantaneous. We're going to start building up, but we're going to start the process. Okay? or you're looking for a hospital to attend, you have a problem, you don't know which hospital have the kind of doctors you need, we will be able to tell you because we're going to have partners with almost all of the hospitals, clinics, and what have in health centers. We can say, okay, Charles, for the problem you have, go to Catholic, go to EWA, go to Benson Clinic, or go to Nukuta Hospital, or go to this hospital in Kakata, so place. There's a doctor there for you. Okay, so we'll be able to tell you where your hospital is and where that doctor is. So if you have a problem that our healthcare practitioner identify when you were talking on the phone, we exactly know which doctor can treat that particular situation, and we can recommend you to go to that hospital. Okay, that's another phase of the digitalization we're going to be doing. The other phase again is the same thing. If you have a problem and you don't know why it is, and our medical person talk with you, and we understand that you need a certain kind of service, we know where to direct you and advise you to do. Also, if you want to go to the hospital and you got to get up 5 o'clock in the morning to get a motorbike and go through town and go to the hospital and sit down there all day. We want to cut that stress out. You're already sick. So what we're going to do is that, hey, Sam, you want to go to the hospital? Yes, we know which hospital you're going to. We will link with that hospital, book your appointment, everything be set up, and the doctors that will tell us, or the hospital tell us that Charles come on Friday at 10 a.m. So we get Sam and say, Sam, listen, your appointment has been confirmed. Your appointment is 10 a.m. on Friday, but be there at 9:30 or 9 o'clock. So that way, Sam is not killing himself to get up 5 a.m. in the morning because you got to beat traffic. You got to go stand online because when you get to the hospital, the line is so long, people so many, to register. Or even our old people who are too literate, they got to go there and be standing. So we make all those arrangements for our people. So when you get to the hospital, when they call your number or your name, you already get your treatment and you walk out. We want to make sure you can spend the minimum as much as you can spend there once you see the doctor. We don't want you to go there 2 days in advance. I'm just joking. To go there 5 a.m. in the morning and come from there 3 o'clock in the afternoon. Let's assume Master Sunday market. Uncle John said headache is sour. But you got to leave all of that and go sit down all day to the hospital, just get seen by the doctor. Only for the doctor to say, oh, come back again tomorrow. No, we want to make all those arrangements so when you go there, doctor can expect you coming, and you got an idea what your problem is, then they prepare to take care of you when you come there. At this point, I will allow Sam to come in and further expand on our services and programs. Brother Sam, joining.
Okay, thank you so much again for letting me in. All of what you said is exactly what MediBridge Access is intended to offer to the public. So this how it works. You call in asking for assistance, whether medication request, whether specialist request, whether you need a licensed health practitioner, maybe a nurse, a general practitioner, a lab technician, whatever it is. After you have called in, let's say for example you are requesting for a general practitioner, and hello, I'm XYZ, and I'm calling in to see a GP. So our nurses station at our office.
Pardon him, ladies and gentlemen, the network in Liberia is a problem. He's going to come back on.
For your HX recorded and transmit it to that doctor, because the doctor has not seen you. We are the liaison between you and the doctor. So we take your chief complaint, we have it recorded, documented, and transmitted to this doctor. So before you and this doctor can meet, he would have seen what your complaints are. And then if you are to meet this doctor, your appointment will not stay long, because we have started the process already, letting this doctor know what all you are complaining on, and what are those things that he will just further, capitalize on that. Maybe you're going to see him for 30 minutes or an hour, and he's going to let you know that this is it, and this is that, and this is that. Then that's a whole train of service. You don't have to stress where, like my brother Charlie was saying, that you have to leave For example, right, they are anticipating diabetes on me, or I'm told to go and do my RBS, that is the rapid blood sugar, or my fast blood sugar, FBS. So I'm not to eat, especially the fast blood sugar. I'm not to eat from my home until this test is done. So after this test, then there's determination going to be made whether my blood sugar level is high or not. So let's assume I have not eaten from 5 a.m., 6, 7, 8, 9, 10. I'm still in the queue trying to see my appointment with this doctor. But the doctor hasn't seen me, needs to talk about sending me to the lab to have my blood specimen, June, and my test to be conducted. So now I'm still here very hungry, and I have come to this hospital hungry with a kind of low sugar level. I'm hypoglycemic. All right. So is it my condition going to worsen, or is it I'm going to be strong? So we are looking at going to the hospital to continue all of this stress, to go from one window to another window, to see this one person, oh, that this not where you should be, or this where you should go, and all of that. So MediBridge Access is here to save you that stress, to make sure we're going to have your appointment set up, and this doctor going to confirm his availability, and we make sure that you are safely with this doctor, where you have gone there and this doctor have received you. We're going to have an like that. Oh yes, indeed, this person has met this doctor, and they are ongoing with the assessment or whatever it is. All right. So basically, MediBridge, we are not treating, but we are bridging the gap between the physician and that of the citizen. We're also bridging the gap between the patient and that of the pharmacist. Because another whole dramatic aspect of our healthcare delivery system is you will see a person will go to hospital after all these hours, after examination, after diagnosis, and he or she will be told their diagnosis, and a prescription will be given out. And kind of think of this. We have a more fatality rate in our healthcare delivery system. It's not because there's lack of professionals or lack of specialty doctors. We have this manpower, but the lack of medication sourcing is a major problem in our healthcare delivery system. So a lot of people don't know where to get their medications from. For example, where they have gotten this prescription, they have attempted going to 2, 3 pharmacies in row, and they haven't seen it. They get frustrated quickly. So at the end result, their condition gets worsened and all of that. All right. So we want to bridge that gap. You don't have to stress to go and look about checking for which pharmacy has this drug. You can sit from the comfort of your office or your home and just call our hotline. Let us know what you want. Let us know we have an app, all right? It's a mobile app where it's easy. It's a user-friendly app where you can just put in your request and it comes straight to us, and we're going to call you via phone, because all of the details going to be there, your name, your contact, your location. Then one of our call center reps going to call you and let you know, oh, fine, we are going to check for this drug and get back to you in a couple of minutes. Then after all of that, when you are told that we can get your drug is at XYZ, do you need delivery? So two options. One, either you're going to let us know that you only want us to locate where you can find your drug, and that's the end of service. That's one. Or you're going to tell us, oh, I don't have the time to go and get it, so you guys can just package it and deliver it to me safely. We're going to do that. So for MediBridge Access, there's no going to be on every prescription. And another good part of our service is we are also in the gap to routinely monitor your prescription. Say, for example, you are on a 6 month prescription. Your prescription it has a 6 month regimen, and you need to be on this drug for 6 months. Trust me, there's something in pharmacy called pharmacovigilance, where when you are off the confines of the hospital and you are taking these drugs, there's a person from the hospital that's supposed to be calling you, checking up on you, letting you know, oh, how are you going on with your drug. It's called medication adherence. Are you taking it as per the way you're supposed to take it? Look, I have a copy of your prescription here. So you're supposed to take this drug 2, 3 times per day. How is Are you taking it with food? Is there any experience? Is there any side effect? Because we have drug interaction, we have food and drug interaction. So with all of that, MediBridge Access going to give you the surety that we're going to handle all of that. We're going to routinely call you, check on you, we let you know, oh, you have 5 pills left. As per our database is reminding us that you have a 5 pills left. So when do you need your next refill? So you don't have to stress all my pills are getting low. I'm getting short on my pills. I need to see how best to call these people again. No, we're going to be calling you back to back, letting you know, yes, we got you, we got your prescription covered, and all of that. So these are some of the services that MediBridge Access going to offer. And aside from that, we are also going to do international appointment. I think Charlie talked about that also, where if we have realized that we cannot find this specialty here in Nigeria and you need, this service that offers, we're going to connect you internationally. We're going to make sure similar service, for example, that we are connecting you with specialists here. We're going to be connected with specialists in Ghana, in wherever we feel that this, service going to be reliable for you. So you don't have to stress. Nothing about connection that you're going to stress on. MediBridge Access going to ease your tension and bring you reliable and easy access to healthcare delivery system. That's why we are MediBridge. The word MediBridge means we are pushing the gap medically for everybody to have access or reliable access to healthcare delivery. All right, there where we are. So Charlie, are you there?
Yes, I'm here. I'm here, and I thank you for that explanation. So, uh, and our family out there, we want to say thank you also for watching. We have more information coming. Uh, we have more information coming out. We're going to be discussing every other day. We're going to come on the air live and give you additional information as our progress. But we are soon to launch, and you're going to see us on the TV, Morovia, the newspapers and flyers, community areas, other stuff. You're going to have us all on your social media. We're going to push our awareness out there to you. But we want Liberia to know that digitalized healthcare delivery system is here and it is coming to stay. Right now, I think we are going to be the first country in West Africa to offer this kind of service. But let's remember again, we are not a hospital. We're not going to call you and tell you, take this medication, take that medication. We will refer you to a respectable doctor that we know can handle you. And when that doctor treats you and give you a prescription, then we set in to help you receive your prescription, follow up, like you said, check on you, make sure. But you can call us anytime, tell us what's going on. We have certified nurses, got great Liberians, ladies and guys. Our brother Samuel is a professional pharmacist in a medical institution. He knows his stuff. Don't mind him looking at, but he's one of the brilliant Liberian pharmacists and medical person that I know. So we're not just speaking from engineer technology part of it. We're speaking from the experience. Okay, he in the medical area, me in the technology area. So we're blending these things to bring it to you so you can have it. And soon, like you said, once we get finished, our app going to be around. You're going to be able to download our app, keep it on your mobile devices. So anywhere you are, you forgot, oh, let me order my medication, or let me talk, I don't feel good, blah, blah, blah. Go to our app. Or you're in the office, you go to our website, you'll be able to get it. Go to our social media, either Facebook, Twitter, or Instagram. All those things will be running in the next couple of weeks. We have all those things up and running live. There's our first channel, our YouTube channel running right now. We're building our Facebook. We're not just rushing. We want to build it properly, put everything we need to be on there. So our phone numbers, our email addresses, all going to be there for you to access. You can call us. We're going to have people standing by. So thank you, Sam. Thanks, everyone, for watching. And again, you can tune in tomorrow. We will be able to come back with another set of discussion. We'll probably go over it again for those who are not here live. You can watch it live on your device. As I speak to you, it is live in real time. I'm watching on my other computer here. It is brilliant. So I want to thank everybody for tuning in. Subscribe to us, please, so that you can be getting the alert. Once you subscribe, you will get the alert whenever we on. it will send you an alert to your email or to your phone that hey, MetaBridge is live, a program is going on. So thank you very much for your time, Sam. Any last word?
Yes, lastly, before I take a leave of you, I just want to say thank you for this live broadcast, at least letting the public know what we are up for and what we intend to offer. At MediBridge, we are solely concerned about redefining the healthcare system of Nigeria. Where we all of those challenges. We're going to correct the wrongs. We're going to make sure that Nigeria is going to be on path like other developed countries where all of these things are easy to access, no body stress at any point in time. So again, at MediBridge Access, we are your partners in wellness. Thank you so much, Charlie.
Thank you, Brother Sam. And ladies and gentlemen, thanks for watching. We see you tomorrow. Bye.